ask Frank Morano. He's in the studio with us. Frank, you're a fairly young guy, and you were forced to get this insurance. Otherwise, you had to pay the penalty. And you're not alone. There are a lot of young guys out there who are paying hundreds of dollars. The other producer is raising his hand behind the screen saying, I'm another one. So I bet you the numbers are high. Why would the government force this on young people? And are you paying for the other people who are using those subsidies?
Well, I think that's exactly right. I mean, but this is part of the problem that I have with Obamacare in general, is that it's so complicated and so complex. I missed the window to sign up for our employer-sponsored health insurance, and I was under the impression that I would automatically be enrolled in the plan that I had last year. Shame on me. I was mistaken. And then I realized...
That's because you didn't read the 2,500 pages.
Exactly.
You know.
But so then I thought, okay, no big deal. I'll go without health insurance for the year. I'll pay the penalty, which I thought was only going to be $90. I didn't realize that it's $90 or 1% of your income. Now, I would have just purchased health insurance if I knew I was going to have to pay an extra $780. But Dr. Samadi, and I so appreciate your conversation with Senator Ward. I have two quick questions, if I may, for the senator. Senator, one, you and Dr. Samadi both talked about the Medicaid expansion that's part of this Obamacare law. I know a lot of the states got all sorts of federal subsidies to help with the additional coverage of people, but we all know that Medicaid is paid for in part by the states and in New York by the localities. What kind of an impact is this going to have on the state budgets as we see more and more people enrolled in Medicaid that the states are going to have to pay for, at least in part?
It's going to have a huge impact on state budgets eventually. But in the way of the federal government, what they do is they basically bribe the states to take on these kinds of things, and they say, we're going to pay 100% of it for a certain amount of time. Then it will transition to 95%, then to 90%. And it sounds like it's a low amount, but it's hundreds of millions of dollars that are going to fall on the backs of the state and the local taxpayers to take on those responsibilities for people that are on health care welfare. And I think it sounds good on the surface level, but whenever you get down to the nitty-gritty, it isn't working in the trenches.
Well, I feel that the gap between Medicaid, Medicare, and I don't know where Obamacare stands on this, but it's almost becoming a single-payer system already, except I think Medicaid is even better because you don't have all the deductibles and issues, and it's a great handout. And this, you have to pay for it.